In this video, we will discuss the items provided to you at the pre-op clinic. Grab your bag and we'll go through the contents together. First, remove the box. Inside the box, you'll find a card with instructions on how to access a series of videos to help you prepare for surgery and know what to expect. You'll also find the following items: a pocket-sized bottle of hand sanitizer, a face mask that you can wear on the day of surgery, a notepad and pen where you can write down your appointments, phone numbers, or any other questions or notes that you have for your doctor, a packet labeled pre-covery. This is a mix for a beverage that you'll be drinking on the morning of surgery, a drug deactivation kit. This is a special bag that you can use to discard any unused or expired medications. Once the medications are placed in this bag, they are safe to dispose of in the regular trash. Also in the bag, you will find a yellow folder named Patient Education Handbook. Open that up and we'll go through some of the key points together. In the pocket of the folder, you will find your pre-surgery and post-surgery checklists. Please use these checklists and check off the items on your pre-surgery checklist as you prepare for surgery at home. Bring it to the hospital on the day of surgery and give it to your nurse. The first page of your handbook is for you to complete and bring in on the day of surgery. We like to post this in your room so that your nurse and other staff can get to know you a bit. Discharge planning should start even before you come in for surgery. If you need extended care after your surgery, your case manager will assist in making the arrangements. Start planning now on who will pick you up when it's time to go home. We aim to have you discharged by 11 a.m., so have your ride plan on coming to pick you up by 11. Please review the guide to chlorhexidine wipes. These wipes are used to prepare your skin before surgery, as they can kill 99% of the germs on your skin. It is important that you follow the instructions on how to use these wipes the night before surgery. You will be given another packet of them to repeat this process in the morning when you arrive to the hospital. After having surgery, you could be at risk of developing a blood clot, also known as VTE, venous thromboembolism. This is a serious condition that can occur when you're not moving around a lot. The best way to prevent blood clots after surgery is to start moving and walking as soon as possible. There are things that can be done to help prevent the incidence of falls in the hospital as well. The most important one for you to remember is to always call for help prior to getting out of bed. It is our priority to prevent infections in the hospital. Hand washing is the most effective way to prevent the spread of infection. Please wash your hands frequently with either soap and water or an alcohol-based hand sanitizer. One way to reduce the risk for pneumonia in the hospital is by maintaining good oral hygiene. In the hospital, you will be given a new oral care kit every day. Brush your teeth 4 times a day, after each meal and at bedtime. Each time you brush your teeth, you reduce the risk of hospital-acquired pneumonia.